one. Hello, everyone. Welcome to Thriving Through Trials, the show that's dedicated to bringing hope and inspiration to those facing debilitating or potentially debilitating diseases and challenges. I'm Dr. Samantha Benjamin-Allen, a board-certified physician in physical medicine and rehab, and the founder of Freedom Wellness Physiatry, a direct specialty rehabilitation consultancy serving the DMV in the home care setting. In this show, we'll be shining a light on remarkable individuals who have not just survived, but thrived beyond their circumstances. We'll be exploring their journeys, their resilience, and the strategies they've used to regain mobility, independence, and improve their quality of life. Our goal is to empower, encourage, and motivate you, our viewers, and provide a source of inspiration in the face of adversity. Join us as we uncover stories of triumph and learn how to thrive through life's toughest trials. Today, I have a special guest, Ms. Janice Russell. She is founder of Optimizing Life After a Medical Diagnosis, and she has used her medical challenges as learning experiences that she shares to help other people thrive in the midst of challenging medical diagnoses. So I'm excited to have her today, and I'm going to let her introduce herself. So welcome, Janice. Please introduce yourself.
All right. Well, thank you so much for having me. This is just a passion of mine. A couple of other things people may or may not be interested in knowing. I call myself the Overwhelm Slayer, since I do help people optimize their life after a medical diagnosis. Ambitious people with, whether it's brain-based or autoimmune or body-based diagnoses, come to me and I help them learn how to cross off their to-dos, manage their paperwork, and optimize their time. And this is done through coaching and accountability. I do have life outside of that. I love to travel, and I've been to 6 of the 7 continents, among other things. Previously to this, I was a special education teacher, and I was in the corporate world as well. So it's just just briefly, because I know you'll have questions. I have had 10 different surgeries. My first one starting in 1981. And in addition to those, I was diagnosed with clinical depression in 2001. And as far as surgeries, I have been at my parents' side through many, and some of theirs have been different from mine. So I know a little bit about those as well.
Wonderful. Thank you so much for sharing. You are well seasoned and well-rounded in a lot of different ways. And I'm just honored to speak with you today because you've had over a dozen medical issues which you share. And this just shows me that you are a very resilient person. And I'm honored to have you and have you share how you learned and grown through those experiences, and how you decided to formulate a system to help people navigate these challenges. So I'm going to touch on a few of your surgeries.
Okay.
The joint replacements, you had both left and right knee replacements, 2017 and 2023, correct?
That is correct.
Wow. And then rotator cuff repair, both sides. And also you underwent mastectomies. So you have really gone through many challenging diagnoses and recoveries, I'd imagine. So I'd like you to share a little bit about the ones that you feel were the most mentally and physically debilitating for you.
Okay. Well, I do want to give credit to my mother, who has had a number of surgeries, several of them prior to my most significant ones, we'll say, and watching her through recovery. She has a very high pain tolerance. She has, she's very motivated to do physical therapy and stuff like that. So I think that really helped me to have that as a model to go with. And not just prior, before I had joint replacements, I had some other knee surgeries, and those were out of the desire to continue running. And that was why I had those two. So I think that also set me up for later on. And I had known for quite a while, my right knee is the one who had 3 surgeries before the joint replacement. So I knew there was going to be a joint replacement at some point.
Right.
And more than anything else, I had to qualify by by insurance standards.
Uh-huh.
So, it was the kind of thing where I was almost happy that it was time, because I'd waited for a while.
Yeah.
Um, Whereas the left one, it came out of the blue. Like literally, the doctor had thought that it would still be 5 or so years before I would need one, and my knee had other thoughts about that.
And he had other plans. Well, that's interesting because runners have some of the most difficulty when it comes to joint replacements because um, if they're very passionate about running, it can set them back and their quality of life is significantly different as they're going through that process. And some fear they'll never be able to run again. And there's debate based on the orthopedic surgeon on whether they'll say it's okay to run again after a certain period of time or not. And I do have a video on my YouTube channel where if you're getting a knee replacement or worried about that, I talk about some of the research behind that. So you can check that out. But it is really nerve-wracking for a lot of people who want to get back to running. I'm a runner too, so that's cool. We have that in common.
We'll say I'm a past runner. I don't run anymore. I'm a walker
now. Were you able to get back to the level of activity that you had prior to needing the knees replaced?
I was. So the right knee was a little bit more challenging in that. And I'll admit part of it was my fault. They gave me, this is what I tell people that are going through joint replacement before they go through. I'm like, they will give you exercises to do before the surgery, do them.
Yes.
Because I did them a little bit. It would have been helpful if I had done them more. And I attended both my doctor's office and the hospital had knee replacement classes, both of which I attended early on. But they didn't, or I didn't hear, not sure which, that the exercises were so important because to have strengthened quads and hams would help my recovery.
Exactly.
So
yes.
I wish that I had really internalized that and done more before.
Right.
And then with that first one, I ended up staying a second night in the hospital, which threw off my additional physical therapy outside the hospital, like the start of that.
Right.
And even though I did do exercises at home, and my mom made sure that I did exercises at home.
Good. You have a supportive mom.
Exactly.
It's really important to do your therapy. So I just want to pull out something very important that you said. Now, you will get exercises before a knee replacement, and this is called prehabilitation. Your prehabilitation is just as important as your post-rehabilitation because this is what's going to allow you to have the best chance at a speedy and good recovery without complication because you are strengthening those quadriceps, which are the muscles, your thigh basically, and your hamstring, which is in the back between your buttock and your knee. These muscles are very important for walking. They're important for stabilizing the knee joint, and they're important for helping to keep that in place and getting you through your recovery much more quickly than if you did not do your prehab. So please take note from this interview. She's speaking from experience. Do your prehab exercises. Thank you so much, Janice.
Happy. I mean, I did a few, but I tell you what, with the second one, I was like religious at doing those.
Yeah, you learned. So good.
I learned the hard way because the first one, I also had some problems early on because I hadn't started physical therapy outside the hospital as soon as originally planned. I had some problems bending my knee, and so that also held up things. So again, the second time around, I was like, oh yeah, I'm doing whatever it takes because I don't want to have, they didn't have to do, I don't remember the name of it, when they have to go back in and basically redo it. There's a name.
Oh yeah, revision.
Thank you, revision. They talked about it, and I like at that point with the right one, I'm like, I'm doing anything to not have a revision. But with the left one, I'm like, I'm not even getting close to a revision.
Good. I'm glad you made that decision because you really do avoid a lot of complications when you're diligent about your prehab. So thank you for saying that. And the other thing that you spoke about was a delay in your therapy. So did you do in-hospital rehab? And we call that inpatient rehabilitation. So it's a very intense rehabilitation program where you do 3 hours of therapy a day, you work with
Oh,
PT. Did you
that
do that or did you go straight to outpatient after the
so
hospital?
I had it while I was still a patient in the hospital, and I was
Uh-huh.
there 2 nights, so I had some each
Oh,
day.
okay. Mm-hmm.
But I was supposed to have my initial outpatient um, knee therapy on a Thursday, but it had already been planned. Like the first few weeks had already been planned.
Mm-hmm.
However, since I stayed a second night in the hospital, I couldn't make that appointment, and they couldn't fit me in, so I didn't get an appointment till the Monday.
Oh, I
So
understand. Okay, so
even though I
that
was
gives
doing
you
stuff at
some
home,
gap
it
there.
wasn't the same as
Gotcha.
being with a physical therapist.
Okay. Well, thank you for sharing. Um, Now, what are you able to do post knee replacement that you weren't able to do when you were really struggling with maybe a lot of pain or difficulty with your mobility? Like, did you ever get to a point where you needed to use a cane or any type of device?
I did, especially with the left one. Actually, not so much with the right one, but the left one took me completely by surprise. I had gone in the summer of 2022. It was irritating me a little, and I'm like, but I knew it wasn't time for a knee replacement. And so I went in and I'm like, I just want a baseline. Because I already knew I had osteoarthritis. Just want a baseline. And I said, now I know you don't like to tell these things, but can you give me a range of when you might think that I might need a knee replacement? And he said 5 to 10 years. And in December of 2022, I was out walking and I had the worst pain that I had ever had. And I've had a long history of knee pain, but it was horrible. And so um, over the course of events, it was decided that I needed a knee replacement. Of course, earlier on I had a cortisone shot, so that meant I had to postpone the knee replacement because you have to wait that 90 days between
Uh-huh.
cortisone shot and the knee replacement.
Right.
But for that time, I was using a cane, and I was in incredible pain. So that is no longer. I don't. I mean, I'm not gonna lie and say I don't occasionally have a little bit of stiffness, but I know that can happen. In fact, even with knee replacements, you can
Hmm.
still be affected by the weather, which sort of surprised me. But
Yes, yes. That
but
atmospheric
yeah, now I can
pressure
walk.
in our bodies, our joints are sensitive to it. And arthritis is one of those things that heightens that sensitivity. So you can kind of sense when it's gonna rain and
Mm-hmm.
you feel that ickiness. So you are right about that. And did you oh, let me just add this for anyone who maybe thinks they could benefit from using a cane. When you use a cane, you want to use it on the opposite side. So if your right knee is the one that's bothering you, you want to use the cane on the left side. And a lot of people confuse that if they haven't had proper instruction. So if you're one of those people who kind of just grabs one without, getting a prescription or recommendation, I wanted to let you know you should use it on the opposite side so that you can distribute the weight and really offload that joint. Now, tell me how you navigated the shoulder rotator cuff repair.
Well, first I navigated by denial, which doesn't work long term. Um,
No, pain and discomfort will win eventually, and you have to do something about something about it. Yeah.
so it was interesting because it was a longer process. I had some shoulder pain and went in, and they did the x-rays, we did the cortisone shot, they recommended physical therapy. I had physical therapy, and the doctor had said, and I'm sure there well, I know there are medical places for these, but I'm like, what I heard in my head was there are two places you can put shots in the shoulder for the pain I was having, place A and place B. And
Uh-huh.
so if the one in place A didn't help, then I could go get one for place B. I don't react really well to cortisone shots, so I was trying to not go the
Right.
second one.
Hmm.
So I continued in physical therapy, and the pain was relieved some, mobility was increased some, but after a long period of time, I wasted time and money by not going back and saying, "Hey, it's better, but it's still here." I wish I
Hmm.
had done that earlier. And when
Yeah.
I went back in I had an MRI, and they said the rotator cuff is torn. So I was very fortunate to have friends who had gone through it,
Uh-huh.
because they could tell me many of the things that you don't learn from the doctor prior to. I mean, even if you take classes, they don't necessarily, for any of the major surgeries I've had, there are always big big chunks of information, like just daily living kind of information that you don't know
That
ahead of
you
time
don't get,
unless
right,
you have somebody who has gone through it, who can give you a heads
right.
up.
So that's also an important point. It's nice to talk to people who've gone through it before. So if you're a person who's going to be undergoing joint replacement surgery and you know someone who's done it, feel free to ask them questions because there are a lot of things that you're not going to know. And that's the role of the physical medicine and rehab physician, if you have one in your corner when you're going through these things, to help you navigate the daily living aspect and the quality of life aspect of recovery after something like this, which you really might not get from the orthopedist. They'll just tell you what
The basics.
the basics, don't do this. And then you're like, okay, so what can I do? Or when can I do that? And all those questions you don't necessarily get the answers for unless you ask. So one major question is, when will you be clear to do certain things? And, along with what you shouldn't do, what can you do? And how will you wipe yourself? How will you do this? How will you, ask those daily living questions. Just think about your daily routine and whatever joint that you're dealing with, think of how you use it in your regular life. And then you want to ask your questions tailored to that. So for instance, with your shoulder, wiping yourself is major.
Yes.
Getting things in the kitchen,
Brushing teeth.
cooking, brushing your teeth, those type of things, getting dressed. So that's important just to ask. And therapy certainly helps you with that. But you want to kind of have an idea of what to prepare for in advance.
Yes. And that, for people who don't have some of the resources you mentioned, that is one thing I help people with a little bit, is just to really think through that,
Mm-hmm.
of what they need, because waiting until the surgery or even the day before surgery, that
Yeah, that's
won't
not
really
the time
help.
to ask this question. Exactly.
And so, like for women, you need a bra that fastens in the front,
Right.
and you need shirts that button up. Well, so do men, but
Exactly.
they don't need a bra, most of them at
Right.
least.
Well, you're a
No,
woman. You
no
don't have to
judgment, no
unless you're
judgment.
going out.
But you need shirts that button up.
Right.
It's more helpful to have pants with elastic.
Exactly.
So many of those little things, and from experience. So interestingly enough, my left one, which is my non-dominant hand,
Hmm.
was done before my right one.
Okay.
And so, I knew what all I needed and stuff like that. And still, there were some things that surprised me, especially in the bathroom, like how much I truly rely on my right hand,
Hmm. Yeah.
um, even though I'd gone through it before.
Right.
So, I was grateful that I had if I had to do it twice, I was grateful I had experience. But I really recommend doing whatever you can to avoid rotator cuff if possible.
Right.
But sometimes you can't.
Yeah. And mainly the best prevention when it comes to musculoskeletal issues is mobility and exercise and having a routine that's consistent and having some strengthening along with, aerobics and stretching, having that combination and having some lightweight exercise about 2 days out of your regular routine during the week to strengthen the muscles that surround the joint. And
Mm-hmm.
stretching is really important. People pull things and things, get out of joint just because the body mechanics might be off. So you want to make sure that you're having the proper body mechanics when you're exercising. And some people might use a personal trainer initially just to make sure they're doing things correctly. But those are just some things to think about. Now, Janice, tell me if you remember about how long it took from surgery to getting back to doing things normally.
So I will say it takes longer with rotator cuff. And interestingly, when I had my second rotator cuff done, I asked the physical therapist, I said, which, which surgery do physical therapists consider the most taxing to recover from? And she said either knee replacement or rotator cuff. And I'm like, rotator cuff, hands down. Like, I haven't had both. I can
Yeah.
tell you without a doubt.
How long was it about?
Well, so the second one was in 2021. Let me think, February. Um, well, of course, you're not supposed to drive until you're off any opioids. So there's that piece. Of course, we all know that's very well managed by physicians in terms of how much you can get.
Right.
I mean, it was at least 8 weeks before I could do like all of the normal things, all of my regular routine things without thinking about it. That being said, I used all 30 of my physical therapy appointments that I'm granted by my
Good.
insurance.
Use
And
all of them. Yeah.
I have learned that when you ask, sometimes it's not that much more to self-pay than to pay your copay. And so
Right.
I have paid for extras if I needed them.
Good.
So
That's
and
good
I
advice.
know
That's good to know.
exactly, because I didn't realize that a few years prior when I had a situation that I needed more and I just didn't ask. And I found out later that it would have only been $30 more than my copay. I realized not everybody has that ability, but I do. So I've learned I do try to do everything I can to stay within the 30, but the 30 is only for the whole year. So it's not per incident.
Exactly. So if you have multiple issues that occur in a year, you might
Mm-hmm.
not get the therapy that you need,
Mm-hmm.
which is an unfortunate issue in our system. So
Mm-hmm.
that's a good thing to bring up. So tell me, what's the most helpful thing someone did for you during your recovery times after surgeries? What would you give what type of advice would you give to perhaps somebody in a caregiver role or a family member or friend who says, I'm going to help out my loved one during this time? What was the
Mm-hmm.
most helpful thing someone did for you?
Mm. Well, this is going to sound like a really little thing, but I honestly think it was the very most helpful thing. I live in a two-story house and my bedroom is upstairs, and
Oh
there's not an
boy.
option to have a
Yeah.
bedroom downstairs. There's not. So what my mom suggested when I had the knee replacements was to have one walker downstairs and one walker upstairs so
Yes,
that I didn't have to carry the walker back and forth.
exactly. And
And
many
that
people
was
do that. We teach that in rehab.
oh good.
Yeah.
Yay.
So, uh-huh.
And often you can borrow, like I borrowed one, I didn't go out and buy it or, anything of that nature. I borrowed one and then I had one from my mom. So that was really a major, a major thing.
Okay.
I think the other, another really big piece is having people who can drive you to physical therapy. Or that you get rides, using Uber, Lyft, whatever, whatever, but
Right.
make sure that you have that in place, confirm that,
Mhm.
etc. They don't even have to go in with you. I've had people drop me off and come back and pick me up. We know about how long it's going to take.
Right.
But you don't want to miss one because of any reason, but especially because of not having a ride.
Exactly. Thank you for sharing that. And at this point in your journey, what would you say you are most curious or passionate about?
I am really passionate in helping other people with any journey having to do with their health. And in this case, since we're talking about more of the orthopedic piece of it or surgery piece of it, not being scared. I know a lot of people get frightened about the idea of surgery, and there are definitely reasons for that. In all of mine, it was more of I'm looking forward to life on the other side of it. Like, I know it's not necessarily going to be easy. I know there's going to be recovery time, et cetera, but I'm looking for the positives on the other side.
Hmm.
And so helping people with that, as well as helping just that preparation, before, like things to know in the hospital. Okay, one of my big things, after a couple of surgeries, I noticed I always had a sore throat when I was in
Okay.
recovery.
Right.
And usually the doctor ordered that I could have throat lozenges.
Hmm.
But one time they didn't, and I was in horrible pain. And so, like from then on, I always took throat lozenges with me and had it in my little pack for when someone could bring me something. Uh,
Always prepared. I love it.
yeah, exactly. Yeah, it's like not nobody would necessarily think of that, but I'm
Right.
like just passing it on.
Right. So
So,
when you undergo anesthesia, they intubate
mhm,
basically, and
mhm,
then the process irritates your throat, the lining, you get some inflammation, you get some hoarseness sometimes. So
mhm.
that's what she's referring to. And
Yes.
sometimes the doctor doesn't think to order lozenges. It's like the least thing on their list of their checklist of making sure to order after surgery. But your comfort matters, and that's annoying.
Well, the other thing that I learned is that finally, before when I went in for the appointment before the surgery, there was one
Mhm.
where I actually remembered to tell them up front about this. And so they used, I guess it's like a, a guided, they used some kind of a scan or something to help guide it
Uh-huh.
down.
Yep.
And I didn't have any problem after that one.
Oh,
So I'm glad that I told them about it,
yeah.
and now
So
now I
they
remember
changed
to
their
tell them every
approach
time.
to avoid that. That's awesome. And that's another good point. Advocate for yourself. And if you notice something, say something, because there might be a
Absolutely.
solution to make your experience much smoother the
Hmm.
next time, if there is a next time. So thank you for sharing that. And what lessons would you share with our audience? Give me a take home message you'd like our
Well,
listeners to take with
I,
them.
I think besides what you mentioned in terms of advocating for yourself, is to the part of that I'll say is knowing your body, knowing when you're feeling things. Even I mean, these days we're all so busy, even maybe jotting it down so that, a week later, if you're still having it, you've had it for a week. Or maybe it was just a one-time incident, like keeping track of that so that you can sort of nip things in the bud, we'll say,
Mhm.
as much as possible. And rather than waiting until they get worse and then it becomes a more serious situation.
Right. Thank you. And I'm curious. I know you underwent prophylactic double mastectomies. Was
Mhm.
there history in your family um, that prompted you to do this? Was there a, a sign of something going on with you already, and you said, you know what, let me just take care of this and avoid any risk in the future? You mind
Mhm.
sharing that?
Absolutely not. I'm more than happy to. I know it's a decision that not a lot of people make, or at least if they do, it's not well known. Um, so my mom had breast cancer. I was told that it was not the kind that was genetic. I mean, it was back in the 90s, so things were a little less well known back
Mhm.
then. Um, but I also met several of the criteria for being at higher risk. Like I didn't have a child before I was 30, and I know there's some others. And then um, after my first biopsy, my breast doctor, I should have looked this up. I want to say it's called the IBS, but I'm not sure. It was just a test where she asked me a whole bunch of questions.
Uh-huh.
When did I start my period? When, that kind of stuff. And it gives you data on your chance of breast cancer versus other in your similar demographic.
Okay.
And my number was like 20% or something, but that was considered extremely at risk. Like I'd have to look it all up to have it all straight. So
Yeah, that's
I
okay.
apologize to
No
people that
worries.
are going, that's not right. I do actually have it written down, but will not take the time right now to look it up. Um, and so I was at extremely high risk, basically, even though there was not a family. I mean, my mom had it, but there, no, they didn't think it would be useful to test for BRCA gene or anything of that nature.
Uh-huh.
They didn't think I would have that. But I mean, pretty much I would have a mammogram, and then 6 months later, I would have an MRI with contrast, which made me sick as a dog. Okay, I can do contrast for other body parts, but contrast for breast MRI makes me sick.
Oh.
And so because I mean, pretty much every time I went in, they would find something and I would have to go and get a biopsy. So after like 2 of those, I was going, it's going to be a really long life of doing this every 6 months or even every year to have a biopsy when I'm at such high risk. So I told, after like number 3, I told my doctor, I said, there's going to come a time when I'm going to be done and we're just going to take them off. And when the last time, when they actually found something on both sides, which we'd only ever had to do 1 biopsy at a time, but in this case there was going to be 1 on each side, and that was numbers 5 and 6. And I was fortunate because the imaging and my breast doctor were right across the hall. So I always made the appointments back to back, and I'd wear my little half gown and go the back way to go across. Cause I'm like, why get dressed only to get dressed?
Exactly.
And I went in and she came into the room and she said, so what do you think? And I said, it's time.
All right.
Go. So that, I was just like, I couldn't see, because it's not that biopsies are that terribly, painful or anything. I mean, they're uncomfortable, but the waiting to find out, like I said, since it was the mammogram, but then 6 months later, the MRI with contrast, I was like, I can't see doing this.
Yeah, and it's very taxing on your emotions, the waiting,
exactly.
I wonder. So I hear you. Thank you for sharing.
Happy to.
And we're going to close up shortly. So I just want you to let us know where our audience can find you. If they need some help navigating, challenging diagnoses and learning how to optimize their life in the midst of that, please let us know how we can find you.
Okay. So my website is actually just my name, but I will spell it because there are several spellings. So it is janicerussell.com. I'm Janice with an ICE, so JANICE, and Russell with 2 S's and 2 L's, so RUSSELL.com. On there, you will find, I do an email newsletter, that free email newsletter that people can sign up for, that has all sorts of articles about all sorts of things. People also have the chance to get a free download called the Top 10 Ways to Manage Your Schedule After a Diagnosis.
Nice.
So and then periodically I have,
guys, get on that.
I do also periodically, actually even tomorrow, I have a free virtual workshop called turning your to-do list into your to-done list. So about once a month I do those. And then I can also be found on YouTube and Facebook and LinkedIn.
Wonderful. Thank you so much, Janice. And thank you, audience, for tuning in to Thriving Through Trials. If you've been inspired by the incredible stories shared on this show and would like to stay connected with us, make sure to follow us on all your favorite social media platforms. You can find us on YouTube, Facebook, and LinkedIn at Freedom Wellness Physiatry. And remember, if you're a loved one or in need of our specialized services at Freedom Wellness Physiatry, don't hesitate to reach out. We're here to partner with caregivers and help those facing severe debilitation achieve greater mobility, independence, and quality of life at home. Simply visit our website at www.freedomwellnessphysiatry.com, and physiatry is spelled PHYSIATRY.com, or give us a call at 240-339-5377. We make house calls in the DMV area, and your journey to thriving begins with a single step, and we're here to support you every step of the way. So thank you for joining. Thank you so much for coming on, Janice. It was a pleasure speaking with you today. And I hope you enjoy the rest of your day. Bye-bye.